can talk about it. We ain't asking no judgment. So don't be ashamed. It's all the same. Stay in your lane. Your lane. It's whatever your real life looks like. Stay in your lane. Come on, talk and don't be ashamed. Your lane. Let's have a conversation on what we face every day. Tune into your late talk show. It makes us feel good just to know we're not alone. No more we've been isolated and cast aside. I want you to show up. Just don't be afraid of your heart. Don't be ashamed. It's all the same. Your lane. It's whatever your real life looks like. Stay in your lane. You must look and don't be ashamed. Your lane. Let's have a conversation on what we face every day. It's your lane talk show with Coach Trish, Hanna.
Hello, hello, hello. Welcome everyone to Your Lane Talk Show with your girl, Coach Trish, Hanna, broadcasting live from the beautiful Nassau, Bahamas. It's hot, y'all. It's hot. It's like 92 degrees today. 92, maybe even be more. But the last time I checked was 92 degrees. I hope y'all drinking y'all agua. I hope y'all drinking y'all agua and staying out of people's business too. All right. For those who are tuning in to us for the first time, Your Lane Talk Show was created to educate, encourage, and empower women of, yes, all ages. All right. Our previous show was hot, hot, hot. We had with us in studio Dr. Mikhail Higgins. All right. He is an interventional radiologist. And of course, we learned so much about uterine fibroids and the various methods and procedures that doctors use to get rid of them. This was last week's show, and it was phenomenal. We covered the procedure that he does specifically, which is the uterine fibroid embolization. Of course, this particular procedure is non-invasive. He spoke a lot about it. And of course, if you want to know more about that, for those who may have fibroids and want to know, what is the best solution for you, you can go to YouTube, search Coach Trish Hanna, and then in the search, you can also put Your Lane episode 61. All right. Fibroids. Yes. Okay. Mike right here. I got you. All right. We're talking about fibroids. So I got so much responses from this show last week because there were so many different people saying, "Oh my goodness, I have this. I had this basically all my life, and I thought it was normal, but the different things that was described, the various symptoms that were described last week were normal to people. They just thought, hey, it's okay to have heavy periods. It's okay for me to have clotting and stuff. This seems to be normal because my mommy had it, my Grammy had it. There's nothing wrong." And that's how they went along with it. And thank God for knowledge, right? Because with that, we understood from Dr. Mikhail Higgins that that's not normal, And so now I want y'all to do me a favor. Everyone that has a vagina, I want y'all to tune in on Star 106.5 FM dial or channel 976 on cable, or you can log in on Facebook on Your Lane Life Coaching Facebook page to watch us live. Because let me tell you something, that's what we're talking about today. We are talking about the JJ and no filters here. Every question that you have, any question that you want to have, any question that may seem, I guess, too private, you can go ahead and text this number 376-8689. You may be a little embarrassed to ask a question on the live, which is fine. You can text the number 376-8689, and of course, to be anonymous when I do ask the question for you, just in case you want to ask the doc. All right, we have with us a wonderful gynecologist and obstetrician. Of course, I'll introduce her in a moment. But she coming in, and let me tell you how she coming. She coming live. She didn't say, "Look, ain't no filter." I said, "No, ma'am, no filter." All right. She's fun, and this is the reason why I'm giving today's episode 80% aha moments and 20% laughter. Because she's down to earth like me. I love her. That's the reason why I always invite her. Now, the last time, if y'all remember, she was supposed to be here. Tomorrow will make a year, but she had a little accident. but she's here and she's ready to roll. And so I'm grateful for our Dr. Nina Graham. Your Lane, episode 62. What's really going on down there? Is brought to you by Airborne Freight and Cargo Services, John Shoe Store and Accessories, Your Lane Life Coaching, Bahama Odds and Ends from Party Supplies, Johnson and Johnson, distributed by Lowe's Wholesale, and Carey's Fabric and Uniform Store. Carey's Fabric and Uniform Store is stocked with uniform fabrics and ready made school uniforms for almost every school in the Bahamas. At Carey's, you will find uniform skirts, jumpers, shirts, blouses, pants, shorts, underwear, and school supplies. You can get your skirts custom made only at Carey's. Shop Carey's Fabric and Uniform Store on Mackey Street, and the number to call there is 3930758. Shop early at Carey's and save. Summer is here. Grab your Johnson and Johnson skincare. Tomorrow is actually the final day to purchase $15 or more of any Aveeno, Neutrogena, and Clean and Clear products and enter to win one of three amazing prizes: a $500 travel voucher, a $250 John Bull gift card, or a $150 Visa gift card. You can pop into any of the Lowe's pharmacies or other participating retailers. Now, being mindful once again that tomorrow is the final day for this particular drawing, and I wish you all the best. Now, to our beautiful, 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 beautiful guest. I'm going to introduce her to you. Her name is Dr. Nina Graham, and she specializes in obstetrics and gynecology. She is passionately about women's health and well being and is dedicated to providing quality, comprehensive women's health care services. Dr. Graham obtained a Bachelor of Science degree in biology from Marymount Manhattan College in New York and a Bachelor of Medicine and Surgery from the University of the West Indies in Trinidad. Subsequently, she obtained a Doctorate of Medicine in Obstetrics. Why keep on saying it like that? And gynecology and certifications in first trimester ultrasound, colposcopy, and forensic gynecology. Dr. Graham is a proud Bahamian and is very passionate about patient education and primary prevention. She encourages regular well women checkups because of her belief in the importance of early detection. Welcome, 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 Dr. Graham. How are you?
I am fine, thank you, and
This is
thank you
home.
once again. Yes, once again for inviting me. It is always my pleasure to sit with you on a Sunday afternoon and talk about women's health. And I'd just like to thank everybody who prayed for me and called last year, July 31st, when I had my little accident. To God be the glory. I'm up and about
Yes.
1 year later.
Wow. 1 year later.
Yes.
Listen, and we're excited to have you. We
Thank
miss you. We
you.
couldn't do anything else pertaining to gynecology and stuff because you weren't here. But you're here now, and we are grateful to that, to God for that.
Yes.
So, Doc, we talking about the vajayjay today, right?
Now, yeah, before we go there though,
Mm-hmm.
I see you tell all the women, everyone who have a vagina to
Uh-huh.
come,
Uh-huh.
but I also encourage some of the men to come
Yes.
to listen too, because
Absolutely.
they need to know. I have had men approach me many times on behalf of their wives
Oh, yes.
and girlfriends.
Yes, and
So
girlfriend.
they need to know too.
Listen, those who like the vajayjay, we ask that you listen to the show today.
There you go.
So, do
Okay.
what you got to do. We're gonna keep that one. I ain't gonna tell y'all what Pete say just now, y'all. But all right. So we want the gentleman also to tune in because we're doing some things. We're saying some things y'all need to know. Y'all need to know what's going on. You just can't like it and then don't know how to deal with it. Pun intended. So let's start. No filter, no filter. All right. Dr. Nina, we want to talk first about proper care. The proper care of the vagina. Primarily about, cleaning, cleansing, what to do, what not to do, products, etc.
Okay. Well, first of all, you don't need to clean the vagina. It cleans itself.
Mm.
Is this on?
Yes, it is.
Oh, okay. It cleans itself.
Mm-hmm.
All right. So many women after their menses or periods,
Mm-hmm.
let's get local,
Yes.
periods, like to douche, and they are taught by their mothers to do so.
Mm-hmm.
That is not a good practice. All right. So the vagina has an odor and is not supposed to smell like flowers.
No.
No.
Well, child, I ain't a part of y'all then, because I'm see from a different tribe, a different planet.
It's not so,
Cause, honey, go ahead.
it's not supposed to smell like flowers and fruits. Okay? Unless you put it down there. The vagina cleans itself.
Yeah.
Okay? And God in his infinite mercy created it so. All right? So every month you don't have to do the douching and the all of the different oils and all of that.
Mm-hmm.
As a matter of fact, when you douche, you change the pH balance in the vagina.
Mm.
You clean out all them bacteria. Bacteria living there, you know.
Yeah.
Yeah. They are the ones that keep it clean.
Yes.
All right. But when you douche, you shuffling all of it out. So you're causing an imbalance and you have bad bacteria or bad organisms that grow more as a result of changing the pH balance in the vagina.
Mm-hmm.
It's supposed to be somewhat acidic. And so when you douche, you clean out all of those bacteria.
Mm-hmm.
All right. And that one of those we will probably talk about in a minute, that causes a bacterial infection called bacterial vaginosis.
Yes.
And so you will notice a change in your discharge from your normal white to a very thin gray with bacterial vaginosis.
Yeah, we're gonna
all
go
right.
there. I see these eyes already opening. Like,
And
what is this y'all set me up with?
with bacterial vaginosis, the vagina, the scent of the vagina changes.
Mm-hmm.
Okay, and women will know when the scent of their vagina change. All right. Every woman has a distinct odor, an odor that is for her vagina.
Mm-hmm.
All right. So when you have a bacterial vaginosis, you're changing the pH balance, you're changing the organisms, and so you get a discharge, you get an odor, and you feel crappy. All right.
We are actually going to talk about the various discharges in a minute, but let me just so we understand now that the vagina does not smell like y'all vagina don't smell like flowers, right? And so how would you describe the scent? Are you able to describe how it should smell?
I don't want to say a little raw,
right?
But it's not like that bad raw,
right?
But it's not sweet. I can't describe it, and I'm saying women's vaginas smell a little different, and then also too after sexual intercourse. I don't know if you noticed that the woman's vagina will smell like the man actually.
Yes.
Right. Mm-hmm. So, yes, and that changes over time when you're going through your cycle or whatever, and different things affect the odor or the discharge, the normal discharge that you would have as a woman. Okay.
And so so let's now talk about the grooming, the various forms of grooming we have. We use nail, razors, waxing. Yeah. What would you recommend as the I guess most efficient or the safest for our JJs?
Well, anything that doesn't cause trauma, first of all, is good. Now, when you use a razor, you tend to get razor bumps and those types of things. So, I mean, and of course, wait, first, before we go there, I mean, for women, whatever is affordable for them, I would suggest because, well, it's some women like a lot of hair
Mm-hmm.
and some women like it bald,
Right.
right? And I'm not suggesting whichever one is whatever you like or your partner like or
Mm-hmm.
whatever.
Mm-hmm.
But in terms of hygiene, the more hair you leave down there, the more moisture, the more sweat, and that type of thing.
Mm-hmm.
So
Mm-hmm.
in that case, it's good to keep it trimmed
Right.
low.
Mm-hmm. Mm-hmm.
And also, and I probably have mentioned this several times, and I do it to my patients all the time. Yeast, right? Fungus, it loves moisture,
Oh.
loves. All right. And then women tend to pass on to their children, their girl babies,
Mm-hmm.
as they start to get their periods, they must wear panty shields.
Mm-hmm.
And so I have young people coming to me with yeast infection.
Mm-hmm.
And I'm like, no, you locking in the moisture. If you're going to wear a panty shield, you need to change it every 2 to 3 hours.
Oh, we going there then.
Yeah, we need to go there.
Mm-hmm. Mm-hmm.
Right. So even though in terms of hair, if it's going to cause a lot of sweat, a lot of moisture, keep it trimmed. And I say whatever doesn't cause trauma. You get um, uh, uh, hair bumps down there
Mm-hmm.
when you. I waxed once, by the way.
Mm-hmm. Mm-hmm.
Child, that was not a good
No,
experience. I ain't going.
that's the trauma right there you're referring to, right? Some people like it.
Yes, I
Yeah.
was like, and they were like, "Oh, that's because that was the first time." I
Uh-huh.
ain't going back.
Never.
I was like, that was not pleasant. So it depends on what your preference
Yeah.
is
Yeah.
and how much trauma
You can
you can
handle.
tolerate.
Mm-hmm.
But also with trauma, you can develop a skin infection, and
Mm.
then with the hair bumps, you can have skin infection. So I've had women who came, I have this bump, and I want to make sure it ain't herpes or any of
Okay.
those things,
Mm-hmm.
and it's like, oh, it's the hair bump. Did you shave
From the
recently?
razor,
You
right?
know,
So, is there a
and make sure
specific
it's
way?
clean.
Of course, is there a specific way to shave to prevent razor bumps, or is there a, you know,
I don't know.
some
Yeah.
people with men
Well,
they
if
have a
that's
way
the
that you go up instead of going down, or you go what? You go with the green,
oh, so it's if it's down, you go down.
right?
Well,
Okay.
yeah, I would say, but for us, I know back in the day when I went to school, it was the they used to call it nair.
There,
So
right?
right, so women, a lot of women, to avoid the
Razor
razor
bumps.
bumps and
Mm-hmm.
stuff like that, they would use nair.
Mm-hmm.
Again, once it ain't going in my vagina,
Right. Once it ain't
whichever
going there,
suits you.
so it just
Yes,
at the top. You do it at the top, and then you
right.
just wipe it off as
Yes.
carefully as possible.
Hmm.
BTIs could be bubbling and raising all day, so get used to it. I mean, his he Beats sipping on
All
everything
day.
he could possibly find today. Yes, it's that kind of show today, Beats. It's that kind of show. All right, so let's. There is and I don't want to call the name. Actually, there are two companies that I'm aware of right now that local companies that use natural products, right?
Mhm.
And one in particular have on her Facebook the actual business page that if you can't use soap to clean your vajayjay, then you might as well don't use soap to clean any other parts of your body. In other words, they sell those type of products,
Mm.
and in those products are things that make the vagina smell like potpourri. See, they have the byproducts. I don't even have the byproducts. And all these different things, right? What are your thoughts on that? And of course, we're not doing any harm to any business, but we just want to
Yeah.
know as a
I actually
gynecologist.
had a business that wanted me to endorse and have, because I have during January month, I
Mhm.
have cervical cancer
Cancer awareness.
awareness month,
Mhm.
and I usually, do a little chit chat talk with the women.
Mhm.
And I was approached, and she wanted me to sell her, and I was like, I can talk about your product, I said, but I don't believe. And again, that's what I opened it up with,
Mhm.
that the vagina cleans itself. All right. So you don't need to put nothing up there to clean your vagina. And I do not necessarily want to endorse doing that because I don't believe it.
Dr. Nina,
I'm
the amount of
sorry.
people who swear on these products, this is
I,
two places. Man, they saying it work and it doing something and this and that.
hmm,
You think there's any harm to it? What can it do
I'm not.
if
I'm
it's
not.
natural? Because the
Is it
products are
like
natural.
is it like a soap?
Yes, it's a liquid and the bar soap
Okay.
that they use
Um, as
with natural products.
that's fine, but when you have a bath or whatever, all right, you're not sticking this soap or whatever up in the vagina,
I would hope not.
right?
Right.
So if you're just gonna clean on the vulval area,
Yeah.
that's fine. That's outside.
Hmm.
Don't go in the vagina.
Right. So that's all you're saying. So the
Yes.
products are fine once it's
It's outside.
outside.
If you want
Okay,
to use
that's
it
good.
underneath the arm or whatever, that's natural. That's fine.
Good.
But you do not need to clean the vagina.
Yeah. What are your thoughts, Dessa?
No, I totally agree with the not putting anything on the inside. I have a question concerning the steaming that became very popular at
Yes.
I
some
have
point
heard
as well.
about that. I
What are your
I
thoughts?
I, I, I don't know too much about the
Okay,
steaming.
so we're
I
gonna
really
Because
skip
you're
that
don't.
what
one.
you're doing is you have
What is
some
the steaming
natural
for?
Go ahead.
substance that they put into the hot water. It's like herbs, not all a bunch of
Is
Natural
this every day?
it's not every day, no.
What is
I
it for?
think
I heard
Cleansing
a
after the
cleanse.
cleansing
menses. Cleansing
cleansing
after
after
your period.
menses is
Yeah.
Again, you don't need to clean the vagina.
now what you're doing is you're actually sitting, you're gonna put that in something and you're gonna sit over a pot of hot water
Hmm.
and the
It's
steam is
called
what
yoni,
goes
I
up.
think. Look that up, Beats. I think that's what the name of it is. Yeah.
Okay.
So I won't even go and ask her about the pearls that you actually stick in there for a few days or a day like maybe 3 days
To
or
clean the
something like
vagina?
that to clean it out and then all kind of things.
Dr. Neil said it's a no.
Yeah, she
It's a
says
no.
it's a no. That's why I'm like I won't even ask her about that. It's a no.
All right,
Oh,
let's
wow.
talk about the discharges then, because you did mention that, and that was a part of what we wanted to discuss. Anyway, so we know that during the month for us, we get various types of discharges. Some more thicker than some, I assume. Some more clearer than some. Um,
Hmm.
what should we be looking at as far as consistency, texture, etc. And then how do we know that there is an infection?
Okay. Um, the type of discharge, as you mentioned, depends on your cycle.
Right.
So, and it depends on the hormones that are in the cycles. So, during the first part of your menstrual cycle, the main hormone is estrogen.
Mm-hmm.
And the latter, after ovulation and the latter part of the cycle, the main hormone is progesterone.
Mm-hmm.
Okay. So, the estrogen is makes the discharge, normal discharge, watery.
Mm-hmm.
All right, as though I say is the water hormone. Okay.
Mm-hmm.
And the progesterone now makes it a little drier
Mm-hmm.
or thicker, right?
Mm-hmm.
So you will notice that at the beginning of your menstrual cycle, your discharge, your normal discharge is thinner, watery, and then the latter part it's thicker.
Mm-hmm.
And then during ovulation, it's kind of sticky or elasticy,
Mm-hmm. Mm-hmm.
right? So you can tell when you're ovulating physically. You know, I mean, some people still get an ovulation kit,
Test. Yeah.
That's interesting. No one
but
ever said that.
yeah. And a lot of there's a lot of ways that you can tell you're ovulating other than using the kit.
Right.
You can take your temperature, you can look at the mucus. These are things that, I mean, for persons who went through infertility, they would know more about it,
Yes.
and they would be looking at these
In
things.
tune in your
Okay.
body. Yeah.
Yeah,
Mm-hmm.
right. And so women have normal discharges. It could be a thicker white, like I said, depending on the cycle. It could be a light clear discharge. You as a woman need to know what is normal for you.
Mm-hmm.
And then there's leukorrhea, that is also normal, and that's the way the vagina gets rid of bacteria that's not supposed to be there.
Mm-hmm.
That's one of the cleansing mechanisms, leukorrhea. All right, and it's just white.
Okay.
It's not as thick as yeast, but it's not as thin as your normal.
So when does that come? Like around what time?
No, you can get that daily actually,
Okay.
because the body is ridding itself.
Okay.
The vagina is ridding itself,
Mm-hmm.
so that's normal. All right. Now you can have a pinkish discharge. Sorry,
Go ahead. No,
a
you
pinkish
continue.
just discharge, which anytime you see an alteration, either pink or brown, that may be somewhat alt blood. So a pink one may be a tinge of blood that's associated with your normal discharge.
Mhm.
You may get that after sexual intercourse,
Mm-hmm.
and that's normal. Okay, you get some trauma during sexual intercourse, and then of course your period, of which actually bleed.
Mm-hmm.
Um, After the period, you may have a brownish discharge. That is also normal. It's basically altered blood,
Right.
right? That's normal. You don't have to go and douche to take that out. It's gonna come out.
Mm-hmm.
All right. So these are normal. These are normal discharges.
Mm-hmm. Mm-hmm.
Now, abnormal.
Mm-hmm. Just before you start with the abnormal, let's just take a quick break. As
Oh,
I see
that's
producer
it.
saying let's take a break, but we want to talk about the abnormal because this will include, of course, um, the yeast infections and all those other things
Yes.
as well, right?
Yes.
So let's go ahead and take a break, beats, and then we get back to that.
Oh, thanks. That's what he was doing.
Hello, hello, and welcome to our Facebook. Welcome, Facebook audience. We want to thank you for tuning in today, and we have some messages here. We said it's good. It's great to have this discussion. Thank you, Dr. Nina. Yeah, so someone is just thanking you for being able to be as transparent about these things as possible
You're
because we
welcome.
need it. Of course, that's what the show is all about. And
Mhm.
we only choose the best. All right. So we want to make sure when we do have persons that come on the show, these are people who do not have a problem being open and transparent and saying, you want to use the scientific terms or biological terms, and then you want to use the layman terms, the street terms, so that we all can ensure that everyone gets what we're saying, right?
Mhm, mhm,
Amen.
mhm.
So let's go ahead. If anyone have any questions, you can go ahead and type it in, or if you want to be discreet, you can text the number 376-8689. That's 376-8689. We're going to go ahead right after this break, and we're discussing the various vaginal infections. What are some of the cures? How do we get these infections? Right as soon as we're done with this break.
So what I have is I have a chart with vaginal discharge on it.
Awesome. You can post it there. That's great.
Suppose I don't know them colors.
That's all right.
Okay,
You
you
got
get
this.
what you have off white,
Yeah, yellow.
you have gray, yellow, green. Okay, that's good. You have any other color I mentioned?
All right, so they have white, yellow, green, clear, gray, pink, and red.
Okay.
Good. That's my
Yes.
doc. She know what she's saying. She got this. Quick question before we go back on the break. When we have, of course, our girl kids, right? Our female girls. When do they start discharging? Is this during,
Once they around their cycles.
right? So anything
Once
before
they
that, their underwear should be clean. Everything there shouldn't be any discharge.
no, but you can have, depending on, you'll have to find out why. I
Right.
mean, is she sexually molested,
Right.
or is this leukorrhea? She can have leukorrhea.
Mm-hmm.
Cleaning out the vagina, right? Is there a foreign body?
Mm-hmm.
All right, those are the three main things I can look at.
Okay.
most of the
I just
time.
want to make sure.
I do get adolescents. I do see adolescent girls,
Mhm.
and they do come with yeast infections. But again, the moisture part, because these young girls wear underwear, boy shorts, tights. I was like, where you going with
Yes.
all these
Yes. Yes.
clothes?
It's coming
Okay, I'm not seeing them yet. Should
You mean
normal
via Facebook?
discharge look the same after menopause? Oh, we're gonna get there. We're definitely gonna get to menopause very soon. That's right on the list. Bye. Welcome back. If you are tuning in with us for the first time, we have with us in studio Dr. Nina Graham, and she's here to talk about everything pertaining to our JJ. I mean, everything. No filters. And be ready, start. All right. And so what we started to talk about before the break was the various discharges that we as women have, and what's normal from what is abnormal. And of course, we do have some abnormal discharges, which of course she would start talk to us about vaginal infections, right?
Yes.
Yeah.
Yes. Okay. So let's start with the most common abnormal discharge, and
Mhm.
that's a fungal infection or candidiasis, or simply called yeast.
Mm-hmm.
All right. That is very common. Now, let me just say that a yeast infection is not a sexually transmitted infection, but it can be transmitted sexually. That's the first thing, okay? Now, the most women could
Hold on, sorry.
identify.
Can you repeat what you said just now? I was reading another question. Say that for
Oh,
me.
a yeast
Mm-hmm.
infection is not a sexually transmitted infection, but it
Mm-hmm.
can be transmitted sexually.
Okay, good.
All
That
right.
was one of the questions actually.
So, because a lot of women come and they run because, oh my God, it's a yeast infection,
Mhm.
and they want to know, and they're afraid that it's a STI. Do I have a STI?
Mhm.
I'm like, no, this look like yeast. And it's like, that's not an STI. I said, no.
But pause there, because if the gentleman is the one that is giving her a yeast infection, where did he get it from?
Well, no, 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 no. She can get a yeast infection
Mm-hmm.
from using antibiotics,
Mm-hmm.
which
No, I'm saying you
changes.
said that it is
It's not sexually
it's not
it's
transferable,
transmitted sexually,
right?
right? But it's not considered a sexually transmitted infection like
Right,
gonorrhea, chlamydia,
right.
and
I
all of
understand.
those.
So if it's transferable,
Yes.
how did he get it? What a
He got it probably from her. And we're going to talk about that in a
Okay. Go
minute.
ahead, talk.
Yes.
Take your time.
So
Go
it's
ahead.
only the stepping out. It could be that he just got it
Yes.
from her. She just didn't realize she had it.
Yes.
Okay.
Okay, so if a woman is using an antibiotic, like a lot of women develop yeast infections from augmentin,
Right.
which is a very common antibiotic that we use in upper respiratory tract infections, air infections, any kind of skin infection.
Yeah.
So it's very common.
Yeah.
And if she has taken that, and some women know, she'll be like, oh well, I just get yeast infections when I take antibiotics.
Right.
So by that I know not to give them augmentin or anything that's related to augmentin.
Right.
Now she can get have a yeast infection from, she may be diabetic, she may be uncontrolled, and a lot of diabetics manifest with yeast infections. Or she just wearing too much clothes, the panty shield, the stockings, the underwear, the boy shorts underneath that. All right. Yeast love moisture. Oh, just
Mhm.
remember that. If anybody goes to the gym and they come home and they cook and they do this and that and the next and they don't change right away, yeast love moisture.
Mhm.
If you like to swim,
Yeah.
you come from the beach, you walk all around the house and whatever, yeast love moisture.
Yes. Yes.
All right.
Mhm.
Now, so you develop this yeast infection and you sleep with your husband or your partner.
Mhm.
So you transferred your yeast infection to your partner. All right. And it is even more so if the partner is not circumcised.
Uh oh.
Uh oh.
Mhm.
Yeast love to also hide underneath the foreskin of the
Wow.
penis.
Wow.
So is there
So when I treat when I manage a lady with a yeast infection,
right,
I send home some caniston for the
just for
husband
the
or the
husband, right? I
partner,
was just gonna say, is there
and I
something that
instruct them. You put it along the shaft of the penis and the head of the penis. Use a condom for at least 3 days or so, or abstain, whichever one.
Mhm.
Let the medication work, all right, or and have sex some other way, right, and then you can resume. But if you don't treat the partner,
Mhm.
then the partner is gonna give it
Right
back
back to
to the
you.
woman,
Right.
and she comes every week or every other. I have this itch. So it's a thick white discharge. It's often described as cottage cheese,
Mhm.
right? But some women, I mean, having that type of discharge may not come out clumped as cottage cheese. It can come out as an actual discharge.
Mhm.
And so, if depending on how the patient presents, you would know if it's a yeast or something else.
Mhm.
So she will complain of itching either on the inside or on the vulva or the outside.
Mhm.
And you can develop actually a cervicitis or so if you have yeast in the vaginal area and it goes up to the cervix, then it's a cervicitis secondary to yeast,
Oh boy.
right? So you're getting problems,
Right.
right? So it has to, so you'll have itching on the inside, and then you can have itching on the outside.
Mhm.
All right, now for patients who are diabetics, they can be first diagnosed. If I'm treating these infections and they still coming back it's
Mhm.
recurring,
Mhm.
I tend to do a hemoglobin A1C to see if they're diabetic,
Mhm.
and I do diagnose some diabetics they didn't know they have. Ask them
Wow.
about their family history. Oh yeah, I have diabetes on my mommy and my daddy side. Oh well,
That's
yes,
it right
yes, yes.
there. That's it right there.
Right. So women, if you have a yeasty looking infection or you have itching, um, you need to. Well, a lot of you like to go and manage yourself.
Mhm.
So they'll tell you, "Oh, I gone to the pharmacy and I got this and I
Mhm.
got that," and
Mhm.
it's still all right. It may be a complicated infection that the over the counter products can't really treat or get rid
What
of.
about natural home remedies? I heard something about
Yogurt.
coconut yogurt and then coconut oil.
Yes, I've heard
Yeah.
of that too.
Mhm.
You know, listen, women are gonna do their natural stuff,
Mhm.
as much as they want.
Mhm.
A lot of them still come back.
Right
All
after.
right, yeah, but yes, I have with probiotics,
Mhm.
the yogurt, the clear, the white one, not
Mhm.
the one with the like strawberry and
Mhm.
that type
Mhm.
of thing, but has been shown to help if you don't want the medication per
Right.
se.
Right.
And
So
So
you
there's
can
smart.
use that. Yeah.
That's so smart.
and the thing is, for women who have come with recurrent yeast infections, um, it is known now that recurrent yeast infections, recurrent sinusitis, and a lot of recurrent abdominal issues
Mhm.
come or stem from the gut. The gut is the second brain.
Right.
And so, a lot of times, if a patient comes with recurrent yeast infections, I also put them on probiotics.
Mhm.
And that's where the yogurt and the probiotic thing comes in.
So is there such a thing as
I don't put them
having
on yogurt, I put them on probiotics, but
right?
I'm
Is
just
there
saying.
such a thing as having too much probiotics, like eating too much, or because they do have um certain supplements that women tend to take just because. Is there a limit to that? Is it something that they do every month, or what are your thoughts on that?
No, you can take probiotics every
Every
day.
day. All
Yeah.
right. And so
Um, you probably need to find out, because there's something called prebiotics and probiotics, and we ain't going into that. But you need to find out though if it's probiotics you need or prebiotics. All right, and I guess your gastro or your natural person will be better to help integrate. I go into so when I speak to a lot of my patients with recurrent yeast infections, I start to ask about their diet,
Right.
how they eat. Is it clean eating, or you eat fast food all the time, and that type of thing. And from that, I can get an idea if a probiotic is the best way to go, in addition to managing your recurrent yeast infections.
So, second to yeast infections, what is the next vaginal infection?
Bacterial vaginosis.
Uh-huh.
Yes. And again, we kind of spoke about that because we were talking about the vagina cleaning itself,
Right.
and if you use douching and that type of thing, you can change the pH balance. And so when you do that, you have an overgrowth of the of other bacteria, and the good bacteria, it's a imbalance basically. So the bad bacteria populates more, and that's called bacterial vaginosis. And that usually the patient presents with a discharge, and they will complain of, in most cases, of a fishy odor. So in addition to having this gray discharge, it don't smell nice, right? So first of all, any discharge that have an odor, you need to come in.
Yeah.
All right.
Yeah.
You don't need to douche. All right.
Come in. Go see a gynecologist right away.
Right. And it's not, some women are bashful. They'll say, man, I have this odor. And then sometimes women come there, I have this odor, and I be like, and I put in the speculum and I open it, and I'm like, I want with it. What odor you got? I ain't smelling it. But a woman knows how she normally smells.
Yes.
So, and if I see a discharge there, but I don't smell an odor necessarily, so I can't very well diagnose her right in front of me.
Right.
Because she may have a little grayish discharge, but it don't smell fishy. It don't smell, but
So what do you do in a situation like that where she thinks that something's happening with her? And
I do a high vaginal swab anyway.
Okay, right.
Because sometimes you may have a mixed infection also, where it may have an odor, but it's not a bacterial vaginosis. And when it comes back from the lab, they just have mixed bacteria. So I'm not quite sure what bacteria it is, but you have a bacterial infection. Sometimes the lab will isolate a bacteria it's not a BV, it's not a yeast, it's not GBS. All right, group B strep, sorry. And so it's a totally different bacteria, right? And so sometimes you have doctors with the history and what they see, it may look like a yeast infection. Let's say, for instance, you swab it and you find out, oh, that's not a yeast infection, that's a bacterial infection, and they tell you what bacteria it is. So you may have to give antibiotics as opposed to. So I mean, we're the experts, yes, but sometimes we're wrong in diagnosing right there.
Of course.
And so if you see a woman coming back to you, oh, the antifungals didn't work, then you need to be like, because from the history you could just say, okay, let me write your prescription for the yeast infection. They come back and they say, well, it worked for a while, but it back. All right, you need to do a swab this time. You understand? So we don't get it right the first time all the time.
Right. Of course.
All right. So we did yeast, we did BV. Now, if the discharge has an odor and it is yellow or green, right? Then you need to check the patient for a sexually transmitted infection. You're looking at gonorrhea, chlamydia, or trichomonas. All right. So you definitely have to do a swab, or you could do a urine test that can pick those up too. In my office, I do a swab to a rapid test and able to tell you if that's the cause.
Mm-hmm.
All
Wow.
right.
And those are treatable.
Yes.
Okay.
Yes.
All right. I guess I can
Now,
ask.
before we hold on, before we go any
Go on.
further, though, I must say some women may have the yeast. You may get a lot of itching, right? Now, bear in mind if you continuously have a discharge and or an itch, sorry,
Mm-hmm.
and you've been treated for a yeast infection and the itch is still there,
Mm-hmm.
you need to check the patient for herpes because
Mm-mm.
a crop or an outbreak, you could mistake the itch of a yeast infection with herpes outbreak. It itches.
Mm-hmm.
So bear that in mind.
Can you talk to us about the herpes?
Okay, well, herpes is viral, and it doesn't usually cause a discharge, but you would see a little set of bumps
Mm-hmm.
on the vulva or even inside the vagina. Sometimes it hides up under the clitoral hood,
Oh
Mm-hmm.
Lord.
right? So sometimes you can really miss it.
Wow.
And like I say, if you have a lady coming back with itching,
Mm-hmm.
you need to. I have to get one of those lights, but I need to get one of those things that the ENT persons do, so
On
you
the
could
Yes.
really look.
forehead.
Now
Look. Yeah.
I have a Colpo light, but sometimes I'm telling you, you could miss it. You need something that magnifies,
Yes.
um,
And you'll be able to see
because
it.
yeah,
Yeah.
and so a viral and herpes is very common. HPV is very common. That's something a little different we talk about, but
Mm-hmm.
it's a viral infection and it's a sexually transmitted infection
Mm-hmm.
also,
Mm-hmm.
but it's very common. And it's just characterized by these little bumps, or they may call it a rash,
Mm-hmm.
on the it could be on the vulva, it could be near the anus, and you have outbreaks every now and again. I think it's more brought on by a stress, reduced immunity and stuff like that. All right, but it's very common.
And treatable as well.
No, it's not treatable. It's a virus.
So
Viral infections, you cannot give an antibiotic. You cannot give a fungal medication for. It's like if you have HIV, but it's not HIV.
Right.
But all of these are viral infections: hepatitis, HIV, herpes, all of them, HPV. All of these are viruses.
Mm-hmm. Mm-hmm.
And what they do is when they get into the cells, they change the character of the cells.
Mm-hmm.
And so it doesn't recognize the cells anymore. And so you can very well treat like that.
okay.
Let's
All
talk
right.
about how you once again we have young children, young girls. One of the things that I guess I wouldn't say I have to take my daughters, or well, they know better now, but I used to take them to the restroom and I ensure that the tissue is wrapped around the toilet. And then I still teach them how to stoop over and not necessarily sit on
Sit.
that.
Mhm.
Can we discuss, what the instances when you do have children that sit on the toilet and then they come back with various
Well, first,
infections?
yeah. Well,
Uh-huh.
first of all, viruses aren't the sexually transmitted infections aren't transmitted like that.
No, no,
The
no, not sexual.
viruses.
No,
Oh,
we didn't finish with that. We
oh,
talking
oh,
something else.
and okay.
No.
No, but I just wanted to correct before we go there.
Uh-huh.
The rashes from herpes, you can manage the outbreaks, or you can take tablets to reduce, because you could have those little rashes for about a week to 10 days.
Mhm.
So if you take medication and antiviral, it can reduce the time
That it's
that
there.
it's there.
Okay.
And there's cream that you can use for the rash itself, but the act and that's why you get an outbreak every so often, because the virus is still in your system. So you don't necessarily get rid of the virus,
Virus.
you
You just
treat it,
treat the.
right.
Okay.
And in between outbreaks, everything is normal.
Yeah.
You could almost forget you have herpes until, oops, yes. And oh yeah, that's herpes.
Mhm.
I'm stressed out. Okay, sorry about that. Now,
That's
the
okay. I just want to
children.
let Odessa know who the hostess is and they are now. So when I have my question, I state my question and the guest answer the question. And then we go back to you when we
She going
finish.
back,
All
man.
right, order. All right. All right. Let's
Okay,
go.
so the
Anisha, go
children,
ahead.
yes. You were asking me if they can get bacterial infections from
Various
the.
infections from, sitting on the toilet and what are some of the
I think it would
housekeeping
be
rules for
more.
that?
I think it would be more skin infections.
Hmm.
What just teach your children to, especially, I mean, public bathrooms, to. I don't know if this sound really weird, but I mean, sometimes just like during COVID, you would have all of these different sprays.
Right.
So some parents have in their bags these Lysol
Hmm.
little
And the
sprays,
wipes and yeah.
right?
Hmm.
And so I would encourage that. From I was young, I was taught not to sit on
Yeah.
on
Yeah.
public. As a matter of fact, I up to now, I'm. If you see me use a public bathroom, is a matter of life and death. I will hold in my urine until I get home,
That's
because and that's how.
Yeah.
but it's so bad that it
You
actually
have to
one time in
come.
high school I got a UTI from holding it in
Yes,
too long.
yes,
Yeah.
yes. So these things can happen,
Hmm.
but yes, I agree with um walking around with Lysol, and
Hmm. Hmm.
I'm a little OCD sometimes.
Oh yeah.
Yeah,
Me
because
too.
I try to teach my nieces too when they
Yes.
come and even use my bathroom in my house. Hold on,
Mhm,
let Annie wipe the seat off,
Yes.
or
mhm,
make sure wipe the seat before you use the toilet, so that
mhm.
when they go out, they
They
be very
remember that.
Exactly.
careful.
Yes.
Yes.
Put the
Yes.
tissue around the toilet and then
Yes,
stoop over how to do it
right.
properly.
Mhm.
So we're gonna take a break, and right after the break, we're gonna talk about menopause. Hey, menopause and a little bit of the menses, just for those who
Okay.
have teenagers and for those who are older but they act like teenagers.
I'm not quite finished with the discharges though, but you didn't mention it.
The what? Sorry,
The discharge.
discharges. All right, we're gonna take a break and then we get back because we time
Mhm.
going. Okay, let's go.
That's a big
You,
thing.
if you want to, you can talk about it now. Let's just take a break.
Yeah. One of the things, cervical cancer.
Right, that's on the list.
Mm.
Oh,
Yeah.
separate from.
Hmm.
Oh, okay, fine.
You want
Then
to
we
wait
could
or you
do.
want to no talk? Let's go because that
Well,
way
the
I want
cervical.
to make sure she get everything. That's what I tell her.
Question about discharge at menopause.
Right, that's what we go into right now. Go ahead.
So what you want to do?
We're gonna do the discharge with the menopause since we're talking about menopause. Go ahead.
Oh, you want me to talk about the
The
menopause
question,
part?
no, the question was asked: should normal discharge look the same after menopause?
No, it won't, because menopause is characterized by um, uh, the hormones, the normal female hormones are no longer there.
Hmm.
So you don't have remember in the beginning we spoke about the estrogen and progesterone.
Right.
So you don't have, well, in some women it can, but the hormones are different. Now, some women who are what I call type, well, I type my patients, my menopause patients.
Hmm.
So a type one, from 1 to 4, 1 to 3, it's almost like, okay, after menopause, you're supposed to get some of the hormones from other organs
Mm.
that's supposed to take over the job that the ovaries
Hmm.
did. Now, in some women, that doesn't happen.
Hmm.
Okay, and those who and then you have some women who use hormone replacement.
Hmm.
So if you have a woman who is on hormone replacement, then her discharge may be the same or similar. I shouldn't say the same, because it's not
Hmm.
the natural hormones.
Hmm.
It's a little. If you're going to take natural hormones, it may be the same. Um, and but if you don't have the body producing the precursors for these hormones, then no, the discharge will not be the same.
Okay. Welcome back. So now we're going to discuss a little bit about menopause. Of course, just during our break, we wanted to answer a question, or we answered a question from a listener on Facebook that asked, should normal discharge look the same after menopause? And Dr. Nina said, no, it shouldn't, unless, of course, you're using some hormonal replacement that would perhaps cause it to be that way. Because she said that the hormones in our body replaces the ovaries. What you say?
There is the adrenals
Right,
produce precursors
right.
that convert to estrogen, or a type of estrogen
Hmm.
that can give you the same or similar discharge.
Similar
Yeah,
discharge.
may not
Okay.
necessarily be the same.
All right. So you said you wanted to finish off with a little bit of the discharge before we continue with the
Yeah.
menopause. Go ahead.
But it's tied in with cervical cancer.
Okay.
Now, the discharge of a patient who has cervical cancer,
Hmm.
and is not diagnosis, that discharge is a more or less a continuous discharge, and it has the most distinct odor.
Hmm.
You cannot miss it.
That's when you have cervical cancer.
Yes.
Ooh.
Okay. So I have had patients before they were actually diagnosed, because I work in prevention
Right.
in gynae oncology. And some women, I remember a couple months ago, actually, a patient came in, and her husband was like, "Listen, you got to do something."
Ooh.
And she came in, and once she walked in there, and she went on the table, and I was like, "Oh no."
Ooh. It was that
I
bad.
didn't have to. I didn't even.
You
have
already
to,
know what it was.
I knew what it was.
Wow.
All
Cervical
right.
cancer.
So it's very distinct.
Right. Tell me
Yeah.
how it smells. What would you describe the scent of cervical cancer? It's fish. Worse than fish scent? What is
Almost
worse than
like
a fishy
dead
scent?
rat.
A dead rat?
It's really bad.
So is this okay for someone who
Or
has
not as
cervical
bad,
cancer?
but
Is there
almost there.
something that they can use in the meantime? Just no.
That's necrotic tissue, cervical
Ooh.
tissue. When I went in, I gotta just break off, a part of the mass.
Oh
Mm.
my.
That's just necrotic tissue. And I sat there and I started to cry.
Can imagine.
And
can
all you
imagine.
needed to do was your pap smear.
Prevention.
Mm-hmm.
All right. So about menopause, because you
That's
know,
heavy.
uh,
That's heavy.
that's heavy. That's why I don't even.
Heavy.
That's yeah. That was
Mhm.
cervical cancer was actually the very last thing before we ended the show, for the same reason.
As a matter of fact, over the last month or so, we diagnosed like four.
From the pap smear.
No.
Just
Patients just coming in with abnormal bleeding, and yeah.
so, what are some of the other symptoms other than the scent and then the abnormal bleeding? What else?
With cervical cancer.
Yes.
Well, um, those are the main things. The main presentation is abnormal bleeding.
Mm-hmm.
Um, and the scent may not come right away. The patient normally presents with abnormal bleeding. Sometimes the patient may be asymptomatic.
Mm-hmm. Wow.
They don't know, and I diagnose them. I may do a vaginal exam and I feel the mass, and then we do a CT scan, and oh wow, it's a big mass there.
Mm-hmm.
But most of the time they come in with abnormal bleeding.
Mm-hmm.
When you see an abnormal pap smear, they have pre-cancer cells, so you can pick up stuff and manage it before it gets to cancer. That's the beauty of the pap smear. The problem is our women aren't doing their pap smears.
Ladies, come on. I don't
And
take a
I
minute.
do a whole campaign in
Oh,
January
come on.
every year, and I don't get more than 100 women
Ladies, we have
for the
to
month of
to do
January.
our pap
Free pap
smears.
smears.
We have to do our pap smears. We have to get annual checkup. This is important. I don't know if the reason can be finances, if you don't have insurance, but whatever it is, I can tell you that if you could just put aside a certain amount of funds specifically for your health, it will be so much easier when you prevent these things. Prevention better
It's better
than
than
having to
cure.
wait until it's too late, and the same monies that you wanted to save for something else, you end up using that to try to help with whatever cures or medications
Yeah,
and
every January I do
hospitalization,
a
etc.?
drive. Every January I do a drive. They only have to pay $50 for the lab.
$50.
Yep,
$50.
it's sad. It's
Ooh,
really
Lord of
sad.
mercy. Okay. All right. Let's menopause. Menopause. Menopause, please. Let's talk about that.
Okay, now you know that menopause is diagnosed basically when you have gone a whole year without seeing a period.
Right.
It has to be a year. Okay. Now, perimenopause is that time prior to menopause when you have all the unpleasant symptoms.
Mm-hmm.
All right. Now, menopause can occur anywhere from, as usually on average around 51. And before that, you can actually go through perimenopause from 40. Okay. So,
You reach out?
I 49
Uh huh.
first.
Okay.
So I've been
You
getting
there? Okay.
symptoms.
Good. Go
Yeah.
ahead. Uh huh.
yeah, so the most common symptoms, of
Symptoms.
course, is
Mm-hmm.
the hot flashes.
Mm-hmm.
Those are the most common and the most unpleasant.
Mm-hmm.
But there are other symptoms that women don't know. I always used to put up a picture on my menopause page of the 12 dwarfs of menopause.
Mm-hmm.
Sleepy, because
Grumpy. Uh-huh.
because of insomnia, so you don't get much sleep, or your sleep is broken up
Mm-hmm.
and you're grumpy the next morning.
Man, these things exist. Listen, I know somebody in my family who every little issue they have, they call it put it say it's menopause because that they claim menopause for every little thing. I said menopause can't last no 100 years because from the time I knew you, you've been talking about this menopause. Any little thing, child, my air ain't working. It ain't. I can't hear nothing. That's menopause. I'm like, really?
Actually, you can get air issues,
Yeah. Well,
vertigo. Yes,
every not it
those
can't
are
be not when you rock your
uncommon.
toe.
Those are uncommon symptoms of
Yeah, but
menopause.
how
One of
long does
them.
these symptoms
There's no
last?
set. There's no set time,
Really?
but you can get a good idea if your mother is still alive or you have an older sibling.
Mm-hmm.
You can find out when, first of all, when they started menopause, and if they're at the point where it has stopped or the symptoms aren't as bad, you can kind of get an idea. But there's no set time. You understand?
Right, so it can last. And then I
Yes.
also know someone who said they didn't really have much symptoms.
Yeah, that's my type ones.
Yeah,
Those are was that person, do they eat healthy, exercise, and that type
I
of thing?
assume she does.
Yes.
Yes.
Usually patients or women who eat healthy, exercise, has not as much stress in their lives, or they manage their stress very
Yes.
well.
Yes.
Those persons transition, or their menopause journey is more of a transition as opposed to something abrupt, like, oh my God, where did this come from?
Mm-hmm.
Oh my God, I'm hot, I'm fine. No, they kind of,
It's a gradual. Yeah.
yes,
Mm-hmm.
those are the ones.
Mm-hmm. I love
Mhm.
that.
And you find that persons who had hormonal imbalances when they were in the premenopausal stage,
Mm-hmm.
are the ones that may have a really difficult time with the menopause journey.
Mm-hmm.
So, patients with PCOS, or who had hormonal problems leading to abnormal bleeding and those
Right.
types of things,
Mm-hmm.
they may have a more difficult menopause. Diabetics, women who may have developed, and that's a stem off or a flip from the PCOS, but women with PCOS eventually go into diabetes, or the pre-diabetes
Mm-hmm.
phase,
Mm-hmm.
and all of it is related to a hormonal imbalance, right? So, and they have no idea. All
Mm-hmm.
right. So those women will probably have a more difficult menopause. These are women who have a sedentary lifestyle. All they do, they may have a job where they just sit in front of the computer and they do this. They
Right.
don't walk up and down to work, or they don't exercise after work.
Right.
And their diet isn't the best. They drink, they smoke, and those all of those women who have that type of lifestyle
Mhm.
may have a more difficult menopause than someone who who
Has a
does
healthy
everything.
lifestyle. Yeah.
Hmm.
Yeah.
Yep.
Wow. Okay, so when it comes to menopause now, because we're gonna start talking about sex now, right? The last time had I had someone on the show, they discussed, their issues when they had menopause as
Mhm.
well. This is a guest, but it's not a professional. Um, they had issues with sexual intimacy because they were, you know, pre-menopausal, not even in the menopause yet. So it was already a lot of dryness and
Oh, it's due to
discomfort
dryness.
for them. So can
Hmm.
we discuss that? We also discuss the various lubrications that you deem to be um, as healthy or as comfortable or as efficient for our vagina? Because not every
You mean
lubrication
during menopause?
during regular women who have sex with lubrication. We'll discuss that later. But I'm referring to menopause for now. Yes.
Okay. All right. So as we discussed earlier, the two main hormones of the menstrual cycle, all right, um, are the estrogen and the progesterone,
Right.
right? But there's another hormone that's very important, not mainly to the menstrual cycle, but important to women, and a lot of people don't know this, is testosterone.
Mm-hmm.
All right. A lot of persons feel as though testosterone is just for men. And I'll be doing my next Facebook Live about that.
Mm-hmm.
But it's not just for men.
Mm-hmm.
All right. What makes a man and a woman is that a man has more androgens or male hormones and women have less.
Mm-hmm.
But we still do need, we have testosterone receptors all over our bodies, just like estrogen and progesterone.
Mm-hmm. Mm-hmm.
So when a woman um, has a problem with sexual intercourse during menopause,
Mm-hmm.
I have to look at her estrogen levels and I have to look at her testosterone levels.
Mm-hmm.
All right, testosterone has more to do with um, her libido, her desire for sexual intercourse,
Mm-hmm.
whereas estrogen has to do with the dryness and that they experience.
Right.
So for women, I do have a special interest in menopause, in menopausal women, and um I don't diagnose them by doing hormonal levels,
Mm-hmm.
but when they're experiencing certain things, I do estrogen, progesterone, and testosterone and sexual hormone binding globulins, of course, because I need to know where you are at and I need to know what type of menopause you are. There are 12 types actually.
Wow. Mm-hmm. Mm-hmm. Yeah, that's
So
right.
I need to know what type you are,
Mm-hmm.
and if you're interested in actual hormone replacements, do you want to do it supplements, do you want to do it with herbs, what do you want? Because some of them will be like, listen, I done been through enough supplements, they don't work, give me the hormones,
Mm-hmm.
right?
Mm-hmm.
So I first find out what they want first, or what are they willing to use. And then, yes, you can use certain lubrications. Water-based lubrications is
Mm-hmm.
easier during the sex act, but you
Mm-hmm.
may need some estrogen to
Okay.
help with that.
So I hope that answers the question from one of the Facebook audience. It says, "Is dryness normal in the vagina after menopause?"
Yeah. Oh, yes,
Yes.
absolutely. And it's very common, and it's a game changer in many marriages,
Wow.
because women don't, the husband think they step out.
Mm-hmm.
But it's not that. It's actually, a lady described it as, during sexual intercourse, because of the dryness, I feel like it feels like sandpaper.
Ooh.
Ooh,
She described it as that. And that was
that's
my
very
reaction to,
uncomfortable.
But you
Very.
see, that's why I encourage men to listen in also, because they don't understand.
Yeah.
All right. So it can be very dry and it's very uncomfortable. And along with a decreased libido, your desire
Yes.
is not there, possibly because of the pain.
Yeah.
Yes.
It's not that they don't desire their partner anymore, but it's very painful.
Yes.
And
It's almost like the female equivalent to orgasm.
it could be, yeah.
Mhm.
But, interestingly enough, there are a few premenopausal women that experience dryness during the sexual act, because I
Mhm.
have had, and I said, oh, I would tell them, okay, we got to look at your hormonal levels.
Mhm. Mhm.
And for some of them, depending on what their contraceptive method
Right.
is, it may affect the hormonal levels, and therefore um, they experience dryness even as a young person.
Wow.
All right, so it does happen in younger people also.
So in situations like that, the lubricants are the best solution for persons who may not have dryness. I mean, I'm sorry, who may not have menopause as yet. So for the younger crew who's still with their menses, and let's say there is dryness there. What
Mhm.
type of lubricants can they use, or
It's a
lubrication can they
similar, yeah, it's a
use?
similar lubricant, but
Is
anyway, I
or would you just recommend
probably,
that they use a supplement to help with that?
they can do that also. Something that's high in estrogens.
Mm-hmm.
There's also, I don't want to talk about it because it's a sore thumb, but they can also try the O shot. There's an O shot and there's a P shot. That's
You know anything with this,
being
Odessa?
Nothing.
Let's
that's
go.
being practiced. Yeah, but I haven't been given permission to use it as yet.
Okay.
Some people use it, but I have not been
What
given
is it?
permission. It's basically, remember in my bio, I told you I deal with platelet rich plasma.
Right.
Platelets are that part of your body that if you have some sort of trauma, you the platelets zero into that area
Right.
to make things well. All of the growth factors and all those cells, kind of all of them come to the area.
Mm-hmm.
So what you do is you take blood from the patient and you spin it down and you re-inject it into the vagina, the upper vagina and the clitoris. And that helps with, it helps a lot with urinary incontinence, which
Mm-hmm.
is basically you pee up yourself when you stoop, when you laugh, when you,
Mm-hmm. Mm-hmm.
right. So it's good for that. And it's also very good in dryness and for persons who are experiencing pain during sexual intercourse.
Mm-hmm.
Yeah.
Okay. But you haven't been given the okay to do that yet. Okay. So because
Yeah.
we want help the ladies. That's what the show is for.
Yeah. Well, it's
So until then,
I understand some offices do it, but some, I don't know who you know and whatever.
oh gee, we ain't going there today.
Yeah, yeah.
All right. So okay. So we discussed lubrication, and you're saying the best would be the water base, and this is something that we had a intimacy coach that came in. She said this is last year, I think. She said even if you're not dry, it's still advisable to use lubrication. Um,
Oh, really?
that's the. I mean, you're the doctor. I'm just telling you what the coach said.
All
So
right.
she's saying that lubrication should be used whenever and for every single time. What are your thoughts on that?
The we have glands in the vagina that um that are there for lubrication, like the Bartholin's glands. Often women have may develop a Bartholin cyst, but that is a gland that produces
Natural lubrication.
natural lubrication.
Mhm.
So I don't see why you need to then go and use. You know what it is. You're in the middle of sexual act. You say, "Oh, hold on, sorry, sorry,
Let me
sorry,
get
sorry.
this. Let me
Let
get
me get
this.
this." No, my lord was better. He was like, "No, I gotta put something there, so you could be lubricated. So why you need to put another?
It
Well, I mean,
reminds.
you
If you're
you
being
get
lubricated normally."
It
Right.
reminds me of when they talk about sex begins in the
Mind.
and
Uh-huh.
not the actual act.
Act.
So
Mhm.
if your partners know each other and they're working together to make this happen,
Mhm.
Yeah.
it should
Automatically.
be automatic.
Yeah.
And the
Rush.
attraction and
Ready.
everything is
Yeah.
there. Yeah.
Yeah.
You don't
Yeah.
need to have no
Yeah.
lubrication.
Okay. I just wanted to
Mm-mm.
hear from you. 'Cause-
But if
yeah.
they do have a problem with lubrication, you need to do the hormonal levels. And then yes, they would probably need to see a sex therapist and
Mhm.
and figure out either on whose side there is a problem, there's difficulty. But you need to specifically speak to the partner and the lady
Mhm.
to see if there's something, like she mentioned, psychological
Mhm.
that
Mhm.
they need to discuss together.
Right.
um
Is your mic on? I want to hear you. Go Beats.
All right. So earlier I compared female dryness, vaginal dryness,
Yeah.
to like erectile dysfunction in men.
Mhm.
And for us, we got your supplements, your things you could
Right.
take. Is that something like that for women?
Supplements for dryness.
Yeah, like
You mean
other
to
than
increase the libido?
no. So what I mean is, all right. So if you have your woman with vaginal dryness,
Mhm.
yeah, you can go and get a lubricant to put in there.
Right.
But is there something that you could take, like similar to the way men would take the blue pill or the red pill?
Oh, the oral supplements.
Yeah. Is there
Oh,
something like that for women?
well, I don't think that I'm not sure the to the level of Viagra and Cialis,
Mhm.
because they always say, hey, I ain't gonna lie, the men have more things available to them
Right.
than we do. And that's why I was complaining so much about the PRP, because I'm like, look, and it doesn't have to be something that you take continuously. Like,
Mhm.
No.
where I trained with PRP, there were couples that come before they go on vacation and they come to get their shot. There's a male version to it,
Mhm. Mhm.
By the way, let me just correct you.
Mhm.
The dryness isn't really the equivalent of an erectile dysfunction. Erectile dysfunction is a condition of the vessels
Mhm.
of the penis. So with us, it's because it's a hormonal thing. With the men, it's not hormonal. Well, it could be actually if you have a decreased testosterone
Yeah.
level, but I wouldn't exactly say it's equivalent.
Yeah, not
but,
exactly equivalent.
but
Because
it caused problems. That's
who
what
was
you
it?
said.
It was Dr. Pinto.
Dr.
When he was
Pinto.
on, he said like ED starts from the heart. It really starts with the heart condition.
Yes.
But yeah.
Okay.
Okay.
Doc, we have someone on the live says, don't be afraid of lubricant. The penis absorbs lubrication like a sponge, and you can go dry in the act if you are having sex for longer periods of time. Lubrication is a friend.
Well, if during the act, I mean, because they're meaning going multiple times, because that's what
Well, she did say
foreplay is.
longer
In between,
periods
okay,
of
you
time.
finish
So,
this,
mhm.
you go, you do the anyway, you do the foreplay, and you could go multiple times.
Mhm.
But okay, I accept what she said.
Mhm. You do have some lubrications, or lubricants rather, that women can perhaps place around the vagina prior to, so you don't have to stop. I heard about those. You don't have to stop in the act. You can actually put it there, and
Oh.
it keeps you a little moist until that time.
Mm.
Yeah, I heard about a few of those.
Oh, okay.
So do what you have to do.
Yeah.
Yeah, do what you have to do regarding that. All right. So after sex care. After sex, you have some people who would rest in their juices, their flows, their sipping, you sipping beats. All right, and some people would rather not clean up because of it's late, they're tired.
I used to. I heard. I mean, when I was younger, that is. They say when you have sex, you should go and pass urine.
That's
Did
not
you ever
true.
hear that?
Of course.
I've heard
Yeah.
that.
Yeah, because I mean it's two different.
I've heard that.
Especially if you definitely don't want nothing to happen. And I was
Right.
like, that don't make no sense.
No, because yeah, it's
But
two
you
different
guys heard of that
departments.
too?
Yeah.
Yes, but can you Can a woman keep semen in her overnight without any effects or issues?
Well, yeah.
I don't think we have a choice. That we can't wash all of that away.
Not all out, but
and, and it'll
some
drain out
stuff,
on its
it'll drain
own.
out on its
Drain
own.
out.
Uh-huh,
But is
uh-huh.
there like, do you get any form
Like,
of infections from keeping it in there?
Hmm.
You ever heard of
but
any?
but I did hear where, I mean, you see where persons who have infertility to
Right.
keep
Oh,
the
they
semen and they
right.
turn upside. You have,
Upside down.
Listen, I done been there. Don't. That's my area. When you done you kick your leg up like this. These are two legs. It's your left and it's your right. And you leave it up there for a long time and let gravity do its work. But that's what the grandparents and the granny them used to say in the
I
church.
was like, yeah, but
But-
no, in terms of
Yes. What? We have
Yeah.
some freshies. Go ahead.
Twins.
That's how you get twins. All right. Go ahead.
yeah, but in terms of, I mean, I don't think it. No, it doesn't unless he had something. You understand? Like if they have if a couple has sexual intercourse and he has like a STI, well, of course, you're gonna transmit it
Right.
through the sexual.
So you
act
can
and
actually
so-
sleep in that. You don't have to worry about any type.
Yeah.
Okay. And I also had I had a friend who says that after her
Are there
menses.
people who actually want to sleep in it? But
I hope
I'm just
not. You,
curious.
you have people who just because after they're finished, they probably just
They
go-
just go to sleep.
I don't know.
Mm.
She after her menses, she would have intercourse with her mate, and the semen from the, after sex, whatever have you, would tingle or burn. Is that a
Yes.
thing?
What do you mean?
I mean,
thing?
do people
It
complain
happens.
about that?
No,
Do you
they
have
don't
women-
come to me for it, but
Right.
I have heard. Yes, I
Right.
have heard. So for me, when persons come and they tell me that,
Mhm.
then I would invite them to bring the partner because it's a possibility. They were like, every time I have sex,
Mhm.
it burns now.
What is
So
that?
I'm thinking that it's a STI.
Mhm.
And for him to come in to get checked, and I check her.
Mhm.
Because especially if it's something that wasn't that way the whole time.
Mhm.
Mhm.
So if it's not
If it's
every
against
time,
the
but if
norm.
it's like, is it nothing to do with cleansing from the vagina or anything like that? And then like right after the is the no. Okay.
Mm-mm.
Okay.
I would not.
Mhm.
I would not make a woman feel comfortable in saying that. That's just
That's normal.
what happens
That's not
after
normal.
that.
Mhm.
I would prefer to be proved wrong after doing tests before I tell her that.
What are some other health tips and benefits regarding sexual intimacy that you would want to
Mm.
look at you that you would want to advise for us women?
We're still on menopause, or just
We finished
in
with
general.
menopause, just but
Oh.
in general. But if you have something
Um,
about it, that's
Well,
fine.
it's always good to before the act. Would be nice after, but it doesn't have to happen. To shower.
Right.
Again, men usually have a lot of pubic hair.
Mm-hmm.
Usually, right? So again, in trimming and stuff on both parties,
parties.
would be good, because you're looking at exchanging fluids, bodily fluids, and certain things. So it's always good to trim the hair. That's all. And in the case where you may have dryness or whatever, you make sure you have a nice water-based lubricant to use. After that, nothing else really. And it would be nice to shower after.
After.
Yeah.
Ain't nobody in the middle of the night gonna go in the shower
They ain't
right
get in the
after.
shower,
That's what I telling
They ain't
you.
get in the shower.
But and then
They
what
wipe
about
off, but they ain't get in the shower.
no, not the whole shower. No.
Okay.
Cowboy maybe.
Yeah.
Dr. Nina, what about is there such a thing as too much stimulation for us, especially when it comes to the clitoris? Is there listen, these old people, they know what to say. But there was I'm not going to say the name of the person. This individual said to me, this was the night of my bridal shower. She
Okay.
said, "You make sure he don't do too much of that down there now, because after that you ain't gonna have no more sensation."
Oh, jeez.
I don't know if
Nah,
to
I
say
remember
ew
that.
or okay, or I don't know what to do. Can you talk to us about that? Is there such a thing that if it's too much stimulation, you have no sensation after?
No.
No, I just
Unless there again, unless there's a hormonal problem or
Mhm.
whatever, nerve problem, because you have it's basically the clitoris is a nerve bundle,
Right.
and it's a small penis. So, man, Mister,
Beats.
can y'all
Beats.
be overly stimulated?
Yep.
It's no, to the point where it wouldn't work no more. No,
Oh,
that's what she
Not that it
said.
wouldn't. Is that what she?
You
Yes,
say
because right,
overstimulated.
overstimulated to the
Yeah.
point where
Mm-mm,
ever?
like you won't feel the sensation as much. I think those were
mm-mm.
her words. You can't feel the sensation. That's what she said. Yeah. Okay. Just
Because the
yeah.
walls of the vagina is designed to feel that.
No, she
I
was
mean,
talking about the
I
clitoris too,
The
though.
clitoris.
The
Yeah.
clitoris is a bundle of is a neural
Mm,
bundle.
nerve.
yeah.
So
So, boy, if mhm.
Go ahead.
if you have a neurological issue, then yeah. But other than that, mm-mm.
Have you had any clients
What?
that came to you
Mm-hmm.
with I know with issues from using sex toys? Any patients?
No.
No. Or you get the good high end type? Because I had some. Yeah. Okay. At least I know.
Really? No,
Yeah, I had
I
somebody on the
would.
show
Mhm.
that talk about certain things that they use and it gets stuck up there.
I
And
have had one patient that came for a foreign body, but it wasn't from a sex toy.
mm,
I know, but I had one that I think one of the caps or something or some sex toy. She started to
it just
yeah
got stuck. So what
yeah.
do you do in situations like that? If something is stuck in the body, in
I pass a
the cavity?
speculum and I find it and take it out.
Lot of mercy.
patch there time.
Yeah, I take it out. Yeah, but I think some women are ashamed.
Yeah.
And I had to explain to her. I said, "There's no reason to be ashamed." I
Hmm.
said, "People use sex toys. I mean,
It is what it
you
is.
know." And
Yeah.
I keep a straight face because I'm like, "Why are you ashamed?"
Hmm.
So
Whew. All right. I think we covered everything. We didn't really. There's one question that I wanted to ask about the sanitary pads. I remember Odessa used to sell these pads.
The all natural
All
ones.
natural ones, right? And from what I recall, I was told that these ones are better because they help with, you know,
They
um,
gave you the better absorption, and then because it was 100% cotton,
right,
it was supposed to have been
right.
better.
What are your thoughts on the various sanitary napkins? Do you prefer
And it
one
was breathable or some
breathable
breathable
than
because
the
you
other?
talked about the yeast loving the moisture,
mhm.
and it
Right.
helped to give more breathing.
so there's such a pad.
Yeah,
Mhm.
there
Yeah.
are
What's the name of
lot.
it?
I don't think that one exists anymore, so I'm not even gonna call that
Oh,
name.
that's
But
well, that's the problem right
if you
there.
go to the health, no, if you go to the health stores, even if you go to the store out west, out
Right.
east, they actually have their section where there are several natural brands of pads and
Mhm.
liners in the
Hmm.
market.
Okay, so you don't have any. There's no particular one about the other that a
Um,
preference.
if there's a pad out there that reduces moisture and it's more aerated, then yeah,
Go ahead.
because it reduce your risk of yeast infections,
Hmm.
but you still should change often.
Yeah.
Right. How many times should? I'm sure it depends on the cycle and the day and the amount, but how many times should a woman change her pads? What is normal?
Um, it depends on how heavily she her periods are.
Hmm.
Um, I have women who say, "Oh, well, I don't like the wetness," so she changes it often.
Hmm.
Because in my history taking, I normally ask, "When did you first start seeing the periods? How was your periods now? How many do you have heavy days? How many pads do you have to use that day?" And I need all of that information
Hmm.
because then now, okay, presently she's coming to me for abnormal bleeding. Okay, so this is what you used to do. All right, so what's happening
Now.
now?
Hmm.
And so some women will tell me, well, it's not that soap, but I don't like
Mm.
to feel the moisture and the
Yeah.
wetness.
Mhm.
But as long as you have a moderate amount of blood on the pad, then you should change it.
Right.
So, and women, their heavy days are different,
Mhm.
right? So, I don't want to say, well, okay, 4 pads a day.
Mhm.
For a lady who has very heavy periods, and she may have fibroids or whatever,
Right.
she may need to use a larger amount.
Excessive amount. Right.
So
For
it's not a
normal,
fixed
so
thing. Yeah.
normal, without the fibroids, because we had Dr.
Oh,
Higgins here. So without.
right. So if it's some women may bleed for 4 days,
Mhm.
right? And they may be heavy those 4 days.
Mhm.
So what's comfortable for them may be 4 or 5 pads per day.
Per day. Okay.
But I
Okay.
don't want to say, oh, you only use 3 pads a day and
Mhm.
that's it, because it varies from one woman to the next.
Okay. All right. I think we covered everything, Dr. Nina. Is there anything else that you would like to suggest pertaining to anything regarding our vagina that we may not have covered?
Well, we covered it a bit, but please get your pap smears.
Please.
And women who have abnormal bleeding, and if they don't, well, first of all, if they had stopped their periods and they're having abnormal bleeding now, that's not normal. You're not young again. That's just something that they say with the older generation. That's not normal,
Mhm.
and you need to exclude cancer. And just for women to take more attention to the discharges
Right.
and the odor. So a lot of women now, they'll come quicker for the odor.
Mhm. Mhm. Mhm.
But they may use an excuse, everything is a yeast infection.
Mhm. Mhm.
But if it's something, if it's a discharge that's associated with an odor that's not normal, you need to seek your gynecologist. And uh, don't douche. Don't clean the vagina. It doesn't need to clean. It cleans itself.
That's it. Don't douche.
Don't douche and don't use the pearls.
Oh, no births,
No pearls.
right?
Pearls?
Many pearls. Go research
Oh,
Yes,
Jesus.
definitely not.
Yeah.
All right. So I think Odessa, you have any other questions
No,
for
I good.
Doctor?
I good.
DJ B, do you have any questions for Doc?
You look
You
like you're
good?
shocked.
He has one, but he's a little bit shy, so he's probably gonna wait until after. But we're gonna go ahead and we're gonna close off the show because I think we covered basically everything. We have our Facebook audience who asked questions. We answered. We had a lot of persons who suggested things, and so we're grateful. Thank you so much to the Facebook audience. Today's show, excuse me, today's show. Um, Before I even say that, Dr. Nina, how can people reach you? Where? How you gonna forget that? How can you be contacted? Because of course, you want, for those who have not gotten a pap smear as yet or annual checkup, please go ahead because it's more than just a pap smear. You check out the other various parts of the body, your blood works, etc. You have to get those things
Yeah,
done.
annuals, yeah.
Prevention is better than
Absolutely.
okay
Cure.
cure. So go
Um,
ahead.
I have several social media
Go
platforms.
ahead.
So my office platform is Femina Bahamas on Facebook, and I have a menopause platform called the Menopause Lounge. And I also have a PCOS platform. People on there don't like talk too much though.
But it's a
But
thing.
it's called PCOS Transformed.
Mhm.
And of course, during the month of January, we post things on our cervical cancer page.
Mhm.
Boy, what's the name of that? I forget.
Mhm.
I don't remember. And we're also on Instagram,
Mhm.
Femina Bahamas, and my personal Instagram. So you can drop a line or message me via any of those social media platforms. I also I operate through Princess Margaret Hospital. So if any women would have an issue with cancer, they will probably meet me at the oncology clinic. And also I have my private office in Palmdale called Femina. And
Where exactly is that? Come on.
Femina is behind Wendy's
Okay.
in Palmdale. So if you're at the Armory Company and you cross over the crossroads, it used to be a school on the corner on the other opposite side.
Yes.
Actually, it's now Boost, so it looks purple.
Okay.
So right when you come across, I'm right there on the right. It's actually a cul-de-sac, and you could miss it. But I do have my sign out to the corner, so you're not going on to Rosetta. It's a little corner right there. I'm there, and my office contact is 6980414. And for those persons who want to WhatsApp the office, it's 8040414. Any of those contacts, you can make an appointment. And I have a lovely assistant. Her name is Davette. You can call, tell her I sent you.
Awesome. All right. Thank you so much, Dr. Nina. Thank you so much for those who've been tuning in. Today's show is brought to you by Airborne Freight and Cargo Services, John Shoe Store and Accessories, Your Lane Life Coaching, Bahama Odds and Ends Party Supplies, Johnson & Johnson, distributed by Lowe's Wholesale, and Carey's Fabric and Uniform Store. Carey's Fabric and Uniform Store want to remind you that they are fully stocked with uniform fabrics and ready-made school uniforms for almost every school in the Bahamas. At Carey's, you'll find uniform skirts, jumpers, shirts, blouses, pants, shorts, underwear, and school supplies. You can get your skirts custom made at Carey's and shop Carey's Fabric and Uniform Store on Mackey Street. If you shop now, you will save. The number to call there is 393-0758. If you need coaching in any area of your life, including premarital coaching, knowing how to restore your marriage, how to stand even when you feel abandoned, or how to build your relationship, please go to my website, www.yourlanelifecoaching.com, and schedule an appointment. I would love to help you improve your life and your relationship. Now, next week, we have with us in studio marriage counselors Mr. Joel and Sherilyn Ross. They will be speaking to us under the topic Defeating Anti-Marriage Forces. Wow, I'm excited about that show because we see so many people divorcing and we're thinking that it's the spouse that is at fault. And in actuality, it's not the person, it's the things operating in that person, or the spirits operating in that person, or the forces operating in that marriage. So you want to tune in next week to find out what that is about. You are in courts. For those who may be presently going to court now, you're fighting the wrong entity. Stay tuned to find out who you should be fighting or what you should be fighting. Thanks to my producer, Beats We Leaving Now. Thank you to my Facebook audience, our continued listening audience, and our first-time listeners. Thank you so much for tuning in. Please follow the page, Your Lane Life Coaching, on Facebook to get all of the updates and goodies from the show. And you can also go to Coach Trish Hanna on YouTube to watch the previous shows. Please like and subscribe. I pray that you were all empowered, educated, and encouraged today. And until next time, happy Sunday. And also say thank you to my one and only.
Yes.
You know, I can't end the show without acknowledging her, Odessa Francis. Anyone, Odessa, you still single? You dating? What you doing? Anyone out there want to date my friend Odessa? I mean, she's a good pocket. She's a turnkey. You know, she know how to cook. She know how to clean. Let me stop. Listen, but she is a woman of God. She knows how to pray. She got this the whole package. All right. So if y'all want to go on a date with Odessa, y'all reach out to me first. I need to try to vet you to make sure you're okay. You're no criminal, and then you can go on a date with Odessa. He may change.
Yeah.
Okay. Well, I give you two
And let
years
him
after I
change
didn't read.
first.
I didn't read all the criminal records. I give you 2 years
Yeah,
because
yeah.
transformation ain't gonna just come just like that. All right. Okay. So that's for that's up. All right. So Dr. Nina, thank you once again. Thank you, thank
My
you, thank you.
pleasure.
As always, don't let this is not gonna be the last time you come here. Just want you to know. This is your show. You are gonna come and you're gonna talk about other things. Everything pertaining to women, because that's what your show's about. Anything to do with our health, the other issues, breast cancer. There's so many different things that we go through as
Mhm.
women that we know for certain that you are more than capable to talk to us about. Yeah.
Yes.
Yeah. All right. So until next time, yes, please.
Oh no, I just wanted to ask a question before you.
Ask a question.
Before you want to answer on that.
Go ahead.
What's the most scientific way to put
Go, Beats. Just be blunt.
You can do it.
Explosive vaginal discharge that occurs during sexual intercourse. Fact or
Squirting?
fiction?
Oh, you mean
Squirting?
squirting?
Squirting.
Come on,
I
man.
want to say it like
Yes. Okay. Does that really exist?
I don't know. I keep on hearing about it.
I guess
Yeah.
I know. I know. Calm.
Yeah.
But
But to a point where
explosive. I think that's a myth.
like across
Well,
the
then,
room.
across the
Uh,
room.
across the
no man.
you watch too much porn.
No, my friend-
You what? Your friends.
I don't
Your
think
friends,
that,
friends.
Yeah.
Yeah, that's porn.
I don't know about that.
So okay.
But to be quick, huh? Who's Nadia?
Across the room, Nadia?
Someone on the face across the room. What that is y'all using? What it is?
Tell me.
We didn't even talk about orgasms. Let's talk about that real quick since we're already off the air. Let's talk about orgasms. There are persons that complain, and like once again, I had the sex coach or intimacy coach on air.
Oh, who was that?
Her name is Tamika Bow, Tammy LaCroix. And then I also had
I know that name.
and then I also had what's her name, who was also an intimacy coach. But I don't know if we spoke about orgasm, did we? That
They have a new coach, sex therapist.
She was on. She was on the show.
She
I'm
was on
looking.
before?
What's her name again?
She's white.
Yes. See her hair, but okay.
What's her name?
I can't remember.
I wanted her to help me with my study.
Well, I'm looking
Because
for her flyer.
can you believe to do the O shot and the P shot, they told me I have to do a study, a whole research.
Wow.
And I had contacted her to
help you with that.
What do you mean gap? Tommy.
Why can't I find her
the
flyer?
same
Maggie. Look at God.
Maggie, yeah.
Maggie.
that's her
So she
name.
was on. Yeah, she was on our platform, and we were talking. Let's talk a little bit about that real quick about orgasms. What is normal, was not. Why is it that some women do not have an orgasm? Yeah.
But I just said, shot is a very suggestive.
The O shot. Okay.
Very
That-
suggestive.
Yeah, over O is for orgasm.
Mm-hmm.
Yeah, and the P shot is for the penis, huh?
That's what it's for. The whole shot.
You do get better orgasms, yes.
Really?
So I mean,
Yeah.
that's for. Hold on, wait.
Oh,
but the
no,
other-
And guess what? Is a
Hold on.
patient who introduced me to that.
What?
So who's stopping this? The government?
The ethics committee.
Oh,
The government.
but have you had some people
My
doing
my
that?
application has been in.
So, I mean,
But this is for regular like young people like myself, and that's all we could have that, or it has to be for someone who has issues with libido and
No,
dryness.
I mean, no. You
asking for a friend.
It's different.
No, it doesn't.
It's different. No, it's different. Things they use it for urinary incontinence.
Mhm.
They use it for orgasms. They use it for libido. I can tell you all the secret.
Come.
I had it.
Ooh, tell me how it was, Doc. Tell me how it was. How- It was good.
Yeah, because to learn how to do it, we had to do it on each other.
Mm-hmm. And it worked good. He was happy.
Yeah.
Oh
But
God.
some people they come every year, like I say. Mine's still working.
What? Ooh.